when a patient comes in, you obviously have to do some tests and examinations before you can make a diagnosis. I want to show our viewers some of the things that you look for in a physical exam, and you can add to this. I'm sure there are other things that you do, but you're looking for a humpback, correct? Or kyphosis?
Right. Yep.
Tenderness over the affected spinal bone or bones. Anything else you'd like to add, Dr. Mena?
Normally, most for people with compression fracture, the most common one will be the tenderness over the pinpoint tenderness over the center of the spine, specifically at the level that they have. Also, we want to make sure that there's no neurological deficits, meaning that when we do the examination, there's no weakness, that there is no foot drop. They have intact sensation, they can feel really well. So that will at least give us a breath that there is no significant compression of the nerve in the spine.
Dr. Pazionis, want to add something to that?
So that's generally the neurological examination that I'll conduct. In clinic, I also do a gait exam to look at how the patients are walking and if they're able to stand to sit. So we have a number of measures that we'll also use. Time stand to sit, which is how long it'll take you to get up and walk 10 seconds. So understandably, this is very important for people's everyday lives, and it's more of a test of functionality.
And once they do that, you clearly can see.
I can see that they're not able to stand up. They're using more arms to kind of help them stand. People will oftentimes be holding their back and holding themselves in a posture where they're very clearly guarding their backs. So you can really just get an idea of how uncomfortable the patient is, unfortunately. Also, you look at their overall spinal alignment. So this was mentioned before with the kyphosis or with the stooped posture that we were mentioning. And that'll give you a good indication of not just the one fracture, but has this patient had multiple fractures in the past? Is this a patient who has had this problem for quite a while?